this section, we're going to be discussing many of the ethical dilemmas and challenges that they're facing. Dr. Emanuele Russo will be speaking about this section, so I'll yield the floor to Dr. Russo.
Okay, hi everybody. Okay, first question is very hot topics. In Italy, there's an active debate about it. As Dr. Ceccelli already told you, in Italy we have central department of the health and 20 different district departments, one for each region. And as the outbreak is not the same in the different region, we have different decision by the local government. Because, of course, if we should leave in quarantine all the asymptomatic people, it should be better. Because now it's clear that the main source of the outbreak of the infection is asymptomatic people. COVID disease is asymptomatic in half of the cases. And but in some region, if we leave in quarantine all the asymptomatic but infected member of the staff, the health system is in danger of collapsing. So I think that there's no an answer, but the answer is in the number of the infected people for each hospital or region. Okay, question number 2 and 3, I think we have the same answer. On the 6th of March, the Italian Society for Intensive Care, Anesthesia and Pain Medicine has published some guidelines, very interesting, because the COVID disease is considered as disaster medicine. Okay, we are not used to reason in terms of disaster medicine, and disaster medicine means that there is an imbalance between resourcing and needs, and so the priority is for patients who are most likely to survive. And so the answer to question number 3 is we give priority to patients who are most likely to survive. And the answer at question number 2 is the same. I think that an healthcare provider maybe has a good chance to survive because he's not old, and if he works, I think he is in good health. Okay, so I give him priority if he has good chance to survive. Okay, number 4, we don't have an ethics team. We have an ethics committee, but it doesn't mind about this question. We had 2 important meetings last year with all the members of the staff, doctor and nurses. It was very, very important because in Italy, the medical guilty could be even a crime. And so we learn to distinguish between ethics and law. And I think those meeting was very important for us, and we will do some more again. Okay. Number 5, in Italy, intensive care, palliative care, and anesthesiology is the same master class, master specialization. So avoiding respiratory stress for every death is our first goal. And for Italian rules, we are used to give sedative to all the patients suffering, and even if giving some drugs could shorten the life, but avoiding suffer, the first goal is avoiding suffering. Okay, this is clear for all the patients, COVID or non-COVID. How are you managing family visits? Unfortunately, we have a national law that not allowed at all family visit, even in the end of life scenario. This is the opposite what we do usually, and I think that is a source of emotional distress, very important for all the physicians. And so far, we haven't had any death in our intensive care, but all the physicians that had that in the department told us that one of the worst experience is people living alone. We are not used to this, and I don't like it too. Okay. Body are managed as the non-COVID. The same treatment at all, nothing different. Okay. What advice I can give you? So far, as Dr. Agnoletti told you, we are very close to the front line, but so far we have not imbalance between needs and resources. I think that the only advice I can give you is to improve all the resources. It means mechanical ventilator, beds, and even drugs. We have now close to have problem with anesthetic drugs. And so I think that the advice is improving all the resource, and if we have not imbalance, we have not ethical challenges. Thank you. I'm here for some question.
Yeah, I'll ask one question and then I'll hand it to Dr. Chu. A question that keeps coming up is about the limitation of events and the prioritization of that. I'm sure the ethics of managing that. Can you just walk us through the process of how you prioritize your vents, and then are you running into vent supply issues? And then after this, Larry, I'll let you go on with the next questions.
Okay. It's not yet happened, okay? And this is the main question. Of course, the priority is for the patient who has the main chance. In guidelines, there's an important question. The rules first come, first served is not valid, okay? If we have finished the ventilator and we have a patient ventilated with less chance that the new one arriving, we will, okay, by the Italian recommendation, actually, I think that the new patient with more chance needs the ventilator, and we will ceiling the care to the old one, maybe with less chance than the new one.
Larry, do you have other questions that you collected? Very challenging issues.
Yeah, we do have questions coming in. So a couple questions pertinent to this topic on ethical challenges. How are you ensuring patients with disabilities are not discriminated against?
Okay. I think that there's not discrimination, but maybe and maybe they have less chance to survive to the disease. Okay, this is the question, not discrimination. Okay.
Can you talk a little bit about how you're dealing with that right now, managing that, or how you make decisions around that?
Okay. It's not the same for the same. If he has the chance to survive, I will give him mechanical ventilation and ICU care. If he has less chance to survive, I don't give him. And as I told before you, disability is not the main question, it's chance of survive. It's just this. Okay.
All right, moving on to another question. Are patients that are into cardiac arrest from respiratory complaints pre-hospital worked, or has the decision been made to not work on these patients?
Okay, we usually have a briefing every day, and we have a discussion about all the cases, okay? We usually, maybe one of an anesthesiologist, an intensivist, visit the patient, and after we talk with the colleagues, and in the cases not easy, we have a collegial decision.
Okay, and then do we have time for one more, Bassam, or should we move on?
No, no. If you have a good question, by all means, go ahead. This is a very difficult topic.
Okay, one last question. Was there discussion about ethics for the ambulance before the patients arrived to the hospital?
Okay. Okay. Yes. Outside the hospital, there's a protocol. Okay. But till now in our region, we have no this problem. Okay. The ambulance bring the patient to the emergency room, and then he can be he can receive a new evaluation. In other region, they have a protocol. Okay, for the out of hospital patients. We don't have till now because so far we don't have this problem of imbalance.